Now let's talk about the ways MCAS is diagnosed. This can be a tricky process as diagnosing MCAS involves a combination of clinical symptoms, lab tests, and how a person responds to treatment. The challenge is that there's no single definitive test for MCAS, and the criteria can be somewhat subjective. One common method of diagnosis is based on measuring certain chemicals that mast cells release, such as tryptase. Tryptase is an enzyme released by mast cells, and elevated levels in blood, especially during a flare-up, can indicate that mast cells are overly active. In my own case, I was diagnosed with MCAS due to elevated tryptase levels, which provided evidence of mast cell dysregulation. Doctors may also look at other markers, such as histamine and prostaglandins, which may be elevated in individuals with MCAS. Tests may be performed to measure the levels of these chemicals in your blood or urine. In some cases, tests are conducted during or after a flare-up to observe how your body responds when mast cells are activated. However, the diagnosis criteria for MCAS are not always black and white. Because the symptoms can vary so widely from person to person, and because some people may not have elevated levels of tryptase or other markers, it can be difficult to make a clear diagnosis. This is where it gets subjective. Some people that exhibit all the classical symptoms of MCAS may not meet the lab criteria, yet they swear they have the condition. Their symptoms match up, but the standard tests don't confirm it. On the flip side, some people may meet the lab criteria without showing as many symptoms. This variability makes it challenging for doctors to come to a clear diagnosis in every case. Ultimately, MCAS is diagnosed based on a combination of clinical symptoms, lab tests, and in some cases, how you respond to treatment like antihistamines or mast cell stabilizers. It's important to remember that diagnosis can be a subjective process, and many people may have MCAS without having elevated lab markers or vice versa. If you suspect you have MCAS but don't meet the traditional lab criteria, don't lose hope. Regardless of your lab results, the information in this course is designed to help you manage symptoms and improve your quality of life. I'm confident that if you dedicate time to learning and practicing these techniques, you'll see significant reduction in your symptoms and meaningful improvement in your day-to-day life.